Yay! It is time to kill my channel reporting on the news as an adult because, well, you guys deserve it, regardless of what YouTube says. Coronavirus. That case in California is a new strain. The individual did not meet the criteria to be even tested for COVID-19, so, well, they weren't. And then they showed symptoms, and they found out that this is not a strain traceable to Hubei, so this is the very first patient-to-patient transmission in the United States. The head of Sacramento Health Systems says that the Centers for Disease Control and Prevention did not immediately test a patient infected with the coronavirus in what may be the first case of community spread in the United States. Dr. David Lubarsky, the CEO of University of California Davis Health, said in a note to staff obtained by NBC News that after the patient was transferred to UC Davis Medical Center on February 19th, it asked for the centers to conduct testing, but the federal agency declined. At the moment, they had, at the time anyways, they had not met the criteria for the CDC to even consider testing them for COVID-19. We requested COVID-19 testing by the CDC since neither Sacramento County nor CDPH is doing testing for coronavirus at this time. In fact, footnote, there are only 2 places in the entire United States that are able and capable of testing for the new novel coronavirus, said the note, which was signed by Lubarsky and UC Davis Medical Center interim CEO Brad Simmons. CDPH is an acronym for California's Department of Public Health. Since the patient did not fit the existing CDC criteria for COVID-19, a test was not immediately administered. UC Davis Health does not control the testing process, the 2 officials wrote in the letter. Again, here Bernie Sanders wants bigger government, and here again we have local government would have tested the individual had they had the capabilities. Federal government said no, dropped the ball on it. Yeah, federal government does not mean things are going to go good. It means they're going to go horrible because, yeah, history has shown us that. On Sunday, the CDC reversed its decision and ordered the test. And on Wednesday, the federal agency confirmed that the patient had tested positive, Lubarsky and Simmons wrote. The CDC did not immediately respond to a request for comment on late Wednesday because why would they? They dropped the ball. I mean, my God, come on, we're still talking about a 14-day quarantine period when we know for a fact 24 to 27 is the longest reported strains. So we need a 30 to 45-day quarantine period. So why are we still talking of 14-day quarantine, CDC? Why? Lubarsky and Simmons wrote that from the time the patient was transferred to UC Davis Medical Center, precautions were taken to prevent exposure because it suspected a viral infection. Yet the federal government did not. You got to figure if the CDC was handling the case, they would have just handled it like a normal case, and the infection would have spread right there. At least the local government and the local officials said, hey, you know what, we're going to take precautions. This is not the first COVID-19 patient we have treated, and because of the precautions we have had in place since this patient's arrival, we believe there has been minimal potential for exposure here at UC Davis Medical Center, the memo said, as it was later posted to the UC Davis Health site. The case is being investigated, but it could be the first case of person-to-person transmission of the illness caused by the new coronavirus in the general public in the United States. The patient had no exposure to the virus through travel or close contact with a known infected individual, which means that there is another individual out there who is infected. I mean, how come they aren't mentioning that? That means there must be at least someone else there who is infected, who got it from someone else that had the original Hubei. It went to this person, probably mutated a bit, and then jumped to this person. So there's at least one other person out there. There have been at least 2 other person-to-person transmission cases in the United States, but both involved spouses of people who had traveled to China. A husband in Chicago whose wife traveled to the Chinese city of Wuhan tested positive, and that couple was released from hospital earlier this month. The other involved a husband and wife in San Benito County in Northern California, and the husband had recently traveled to the Wuhan province? You mean the Hubei province? Or Wuhan? But his wife had not, authorities have said. And those ones are different because it's a spouse. You would expect a spouse to get infected by someone, by their significant other that wasn't infected. This case in California, this individual had no contact with anybody that he knew of that had gone to China or anything of the sort. So that means someone else got it from someone, and then he got it from that person. That's the way outbreaks work. The quarantine has not worked, and the quarantine will not work. It has already failed. The coronavirus outbreak has spread from China to at least 40 countries around the world, affecting markets and disrupting travel. A recent increase in cases in Italy, Iran, and South Korea have heightened concerns about the ability to contain the spread of the virus. It's not contained. It is just simply, it isn't. Proof and evidence. The proof is in the pudding. I mean, my God, it is not contained. There's no containment of it. I don't know why you're even talking. It's not contained. Let us help. Let's do containment. Yes, obviously, but let's also look towards the future and be like, hey, you know what? This doesn't look like it's contained. Let's make the proper preparations. Cases in the U.S. have been limited, though the Centers for Disease Control and Prevention said Americans should prepare for the spread of the coronavirus in communities. And when that happens, it is going to boil down to communities, helping communities. The federal government is going to be of minimal help. History has proven that. It's going to come down to communities helping each other out. It's going to be going back like 100 years, basically. And you will have pockets of communities, and yeah, if it gets worse. If it gets worse. CDC says prepare for it. Nothing wrong with preparing for it. So what? If it doesn't happen, well, at least you've got all these supplies. You can go camping or something. Anyways, that's what I got for you on this one. I will see you guys on the next one. I love you. Stay informed and take care of yourselves.